Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. My name is Salman Haq and I am from BSPT. I talk about my presentation. Topic one is artificial tears. What is artificial tears? Artificial tears are a lubricant eye drops used to relieve dryness and the irritations of ocular surface. Dry eye syndrome is a common ocular surface disorder is characterized by disruption of tear film and increased inflammation. The tear film coats the surface of eye and is composed of three layers. First one is an aqueous, second one is lipid, and the third one is mucose layer. The aqueous layer consists of mixture of electrolytes, enzymes, antibodies, antimicrobial proteins, and other components. The lipids layer consists of fatty acid. The lipid layer consists of fatty compounds that are responsible for decreasing evaporations of the tear film. The mucous layer contains mucin, gelatinous glycoproteins which allow for an even distribution of tear film over the corneal surface and decreased friction during blinking. Artificial tears are used to supplement a patient's naturally produced tears and increase eye lubrication by mimicking characteristics of the tear film. Artificial tears can be supplemented with other treatments to treat dry eye syndromes and are available over the counter. Artificial tears are also used to moisten contact lenses and in eye examinations. Next one is the chemistry overview. Although artificial tears are used to mimic or supplement the rules of the tear films and contain water, electrolytes, and the certain polymers. They do not contain the biologically active components found in the naturally produced tears. Moreover, artificial tears often contain chemicals that are not present in the naturally produced tears. Preparation can contain carboxymethyl cellulose, polyvinyl alcohol. And the next one is with preservatives. Preparation can also contain preservatives in order to prolong usage and avoid bacterial contamination. Preservatives include benzalkonium chloride, purite, chlorobutanol, sodium perborate, thiomersal, disodium acetate, and the oxychloro complex. Preservatives can be toxic and cause damage to corneal epithelium. For instance, high concentration of the benzalkonium chloride can cause cytotoxicity, cause cell lysis, and reduce tears and mucin production. Patients should limit the use of artificial tears with preservatives or less than 4 to 6 times a day. If artificial tears need to be utilized more than 4 to 6 times a day, a preservative-free formulation should be used. And the next one is a preservative-free. Preservative-free artificial formulation are indicate for patients who cannot tolerate Artificial tears formulation with preservatives. Patients who are using artificial tears more than 4 to 6 times a day, and patients who are using multiple topical eye drops with preservatives. Preservatives-free eye drops are found in single vials. However, single-unit dose artificial tears without preservatives more expensive than bottle artificial tears preservatives. And the next one is indication and effects of the artificial tears. The most common indication for artificial tears used is dry eyes. Risk factor for developing dry eyes with low moisture, nutritional deficiencies, certain medications, and autoimmune conditions. Example autoimmune conditions are syndrome, autoimmune thyroid disease, and uveitis. Patients with dry eyes may have an inability to produce adequate immune or equality of a teeth leading to a disruption in their teeth films. In addition, those who wear contact lenses or have undergone eye surgeries such as LASIK are at increased risk of having dry eyes. Normal teeth are important to keep the surface of eyes clean and moist and protect eyes from infections. They are composed of many components including enzymes that act as natural antibiotics, proteins that prevent bacterial growth, and nutrient with adequate lubricant. Patient are at risk for infection as well as irreversible scarring and damage. Artificial tears are the recognized treatment of choice for this problem. And the next one is side effects and precautions of artificial tears. Artificial tears have no reported interaction. The most common side effect of the artificial tears is temporary blurry vision. Allergic reactions have been reported and are associated with swollen eyes, dizziness, and the breathing problems. These symptoms warrant discontinuation of the drops and to see physically immediately. Prescription drops may have additional side effects such as burning, redness, pain, and foreign body sensation. For contact lens users, specific drops should be used to avoid ingredients that can damage the contact lenses. If using multiple types of drops, it is important to wait a few minutes in between applications of each to avoid rising out the prior drops. Proper technique should be conducted to avoid contaminating the bottle, washing hands prior to use, avoiding contact between the bottle and eyes can prevent infections. Next one is the veterinary uses. Artificial teats are part of the typically therapy. Typically therapy for animals such as dogs, cats, and horses. Similarly to human uses, proper caring should be performed to avoid contamination of the bottle. Veterinarians should be connected if signs of allergy, irritations, or pain develop due to the usage of artificial tears. Next one is the research article. A 2018 review seeking to compare the effectiveness of the various over-the-counter artificial tears in treating dry eyes. While the review stated that it is unclear which artificial tear Formulation works best to treats found at 0.2% polycrylic acid based teas were more effective in treating dry eye symptom over 1.4% polyvinyl alcohol based teas. Next one is the reference of John Albert 2017 current statement option for the Springer International Publishing Perry Henry December 2003 medication for dry eye syndromes. And my topic is and thank you very so much sir and